If you're on Medicare and you take even one prescription drug, listen closely, because there is money with your name on it right now that can cut your pharmacy bill down to almost nothing. And the drug companies have spent a fortune making sure you never go looking for it. This year, 5 rules changed. 5. Any one of them by itself can save a senior thousands of dollars. Stack them together, and a drug bill of $6,000 or $7,000 a year drops to a few hundred. I'm not rounding up for effect, a few hundred. The pharmaceutical industry fought every single one of these in court, and they lost. So now they're betting on the only card they've got left, that nobody ever tells you how to actually use them. The pharmacy won't. Your drug plan won't. Because the morning you start using this, every one of them collects less. So stay with me all the way to the end. The last change on this list is worth around $5,700 a year on its own, and most of the people who qualify for it have never claimed a single dollar. Let's fix that right now. Before anyone talks themselves out of this, let me kill the 2 excuses I already hear coming. The first one is, this is only for low-income people. Wrong. Some of what I'm about to give you has an income test, and some of it has no income test at all. It protects a retired dentist the exact same way it protects a retired janitor. The second excuse is, I only take a pill or 2, this isn't for me. Also wrong. One brand-name drug in this country can cost more than a used car over a year. You don't need a shoebox full of bottles to get hurt at that counter. Quick word on me. I'm not a lawyer, and I'm not your insurance agent. I can't sit down and run your exact plan for you. What I can do is hand you the names, the numbers, and the exact office to call so you can go collect what's already got your name on it. And do me one favor while you watch. Tell me in the comments how much you spent on prescriptions last year. A round number's fine. I think the answers are going to shock the people reading them. Let's start with that wall, because it's the biggest change to Medicare drug coverage in a generation, and a shocking number of seniors have no clue it's there. Here's how it used to work. There was no limit, none. If you had cancer or a bad autoimmune disease, or you needed one of those specialty drugs that runs a fortune, you could spend $10,000, $15,000, $20,000 a year at that pharmacy and just keep bleeding. There was no top. Whatever the year threw at you, you paid it. That's over. Starting this year, once you've paid $2,100 out of your own pocket for covered prescriptions, you're done. Finished. Every covered drug for the rest of that calendar year costs you $0. Not a discount, $0. Last year, that ceiling sat at $2,000, and it nudged up $100 for this year. But the exact number isn't really the point. The point is that a ceiling exists at all. For the first time ever, there is a worst-case number, and you now know exactly what it is. If you're someone who used to blow past that by March, everything from spring to Christmas just turned free, and nobody's mailing you a letter to celebrate it. Now here's where the drug companies actually started sweating. For the first time in its history, Medicare was allowed to sit across the table and negotiate the price of the drugs seniors lean on the most. Not accept the sticker, negotiate it down. And the first 10 drugs on the list are not obscure little things. These are the giants. Eliquis and Xarelto, the blood thinners. Jardiance, Farxiga, Januvia for diabetes, Entresto for heart failure, Enbrel, Stelara, the medications millions of you swallow every single morning. The new prices went live on the 1st of January, and the cuts are not gentle. They run from 38% off on the low end all the way to 79% off on the high end. Let me put that in real money. Januvia, the diabetes drug, a 30-day supply carried a list price of $527. The negotiated price is $113. Same pill, same bottle, $400 a month lighter. Let me bring it down to one person. Picture Ray, 71, out in Arizona. Ray takes a blood thinner and a diabetes drug, and both of them landed on that list of 10. Between the two, the new pricing quietly knocked a few $100s a month off what he'd been handing over. He didn't switch plans, he didn't fill out a form. He walked in one day, and the number at the counter was just lower. This one change touches around 9 million people, and the government's own estimate says it saves folks on Medicare about $1.5 billion this year alone. That $1 billion used to be drug company profit. Now you can see why they fought it so hard. The third one is the fastest win on this whole list. If it applies to you, you can lock it in this week. If you use insulin, your cost for a month's supply of any covered insulin is capped at $35. That's the whole thing. $35, and you don't even have to meet your deductible first. The cap kicks in on the very first fill in January. People in this country were rationing insulin, cutting doses in half to stretch a vial. $35 ends that math for good. And while we're here, vaccines. Every adult vaccine that's recommended for you is now $0 under your drug plan. The big one is shingles. That shot used to run people around $200 out of pocket, so plenty of folks skipped it, and then some of them got shingles. which anybody who's had it will tell you is pure misery. Now it costs nothing. Shingles, the updated pneumonia shots, the rest of them. No copay, no deductible. If you've been putting that off over the price reason is gone. Go get it. Quick question while we're here, and I really do want to see this one. Has your pharmacy ever quoted you a price so high you left the counter without the medication? Just type yes or no. I want to see how common this really is, because I don't think most families realize how many of us have done it. Number 4 doesn't lower your total, and I'm going to be straight with you about that, because it's the one people get wrong. But it fixes something that quietly wrecks a lot of retirees anyway, the timing. Here's the trap it solves. Say your big, expensive prescription hits hard in January. Under the old way, you could get slapped with a $600 or $700 bill in a single month, right after the holidays, right when the account's already scraped thin. The new Medicare prescription payment plan lets you take what you'd owe at the counter and spread it into flat monthly payments across the whole year instead. No interest. It costs nothing to join. You're not paying a penny more over 12 months. You're just never getting flattened by one brutal bill on one brutal morning again. For anyone living check to check, smoothing that out is the difference between filling the prescription and leaving it sitting on the pharmacy shelf. You call your drug plan and you ask to enroll in the Medicare prescription payment plan. Say it just like that. And now the one I told you to wait for, the big one. This is the single most valuable thing on this list, and it is the most ignored benefit in the entire Medicare system. It's called Extra Help. Some folks know it as the Part D low-income subsidy, and I need you to throw out whatever picture you've got of the words low income, because the limits sit far higher than people assume, and they just got better. Here's what Extra Help actually does. It pays your Part D premium for you. It drops your deductible to zero, and it caps what you pay for a covered prescription at $5.10 for a generic and $12.65 for a brand name. That's the whole cost. Not per day, per prescription. Social Security's own numbers put the average value of this at around $5,700 a year for one person. Now the part that decides it for you. Do you qualify? For this year, a single person can bring in up to $23,475 a year and still get it. For a married couple, up to $31,725 a year. There's a savings limit on top of that, and it's not small either. And here's the change that blew this thing wide open. It used to be that if you sat near the line, you'd only get a watered-down partial version of the help. That's finished. Now, if you qualify at all, you get the full benefit, every last dollar of it. Here's what genuinely bothers me about this one. Millions of people who are eligible for Extra Help right now, today, are not signed up. They're paying full price at the counter, some of them splitting pills to make it stretch, while a program that would cap every prescription at a few bucks sits there with their name on it, untouched. Not because they got denied, because nobody ever told them to apply. You apply through Social Security. It's free. You can do it online or you can do it by phone. The number is 1-800-772-1213. Ask for the application for Extra Help with Medicare Drug Costs, by name. So let me put the whole thing back together, in order, because any one of these 5 can turn your year around. 1. The hard cap. $2,100, and then every covered drug is free until the calendar flips. 2. The negotiated prices on the 10 biggest drugs, already lower at the counter, no paperwork on your end. 3. Insulin at $35, and every recommended vaccine at $0, that shingles shot included. 4. The payment plan that spreads your costs out so one bad month never knocks you flat. And 5. Extra Help, around $5,700 a year, prescriptions capped at a few dollars each, and probably the biggest check you'll never get mailed. Stack even 2 or 3 of these together, and a person paying $6,000 a year for medication can walk that number down to a few hundred. That's not pocket change, that's a property tax bill. That's a couple months of groceries. That's real money, back in your hands, every year for the rest of your life. And here's the thing I want you to hold on to. The people who use all of this aren't sharper than you, and they didn't get lucky. They just heard about it before you did. That's the whole difference. These changes are new. They are the law right this minute, and the industry that lost billions over them has never once stopped trying to claw them back. So use them while they're sitting right in front of you. Do one thing for me now. Send this to one person over 65 who takes a regular prescription, because I promise you, somebody you love is overpaying at that counter today and has no idea a word of this exists. If it was worth your time, a like helps it reach more seniors who need it, and go ahead and subscribe if you want the plain English version of these rules as they keep shifting this year. Then tell me down below, which of these 5 did you already know about and which one just caught you completely off guard? I read them and I answer. I'll see you in the next one.